Hello everyone and welcome back to Scientist Express. In today's video, we are diving into a fascinating and incredibly important use case of machine learning in the healthcare sector, where we explore how AI can predict the success or fatality of a medical transplant. If you have ever wondered how technology helps save lives in complex medical scenarios, this video is definitely for you. But before we dive deeper, if you are enjoying the content so far and want to stay updated about the latest innovations in science and technology, make sure to hit the subscribe button and turn on notifications so that you don't miss an update from Scientist Express. Now let's get back to how AI is revolutionizing the healthcare space. Every year, countless transplants are performed. Transplants that save lives, improve health, and offers patient a second chance. However, despite medical advancement, not every transplant is a success. So, what if we could use machine learning to predict the outcome of a transplant? Specifically, whether it will be a success or it will lead to an adverse event like fatality. One critical procedure in this domain is Hematopoietic Stem Cell Transplant or HSCT. It's a life-saving treatment primarily used for patients with blood disorders like blood cancers, thalassemia, and various other immunodeficiency diseases. This procedure essentially replaces a patient's diseased bone marrow with a healthy stem cells, thus restoring their immune system. HSCT has been practiced since 1950s, and over the years its success rates have steadily improved. But despite its high success rate, there are still cases where the transplants results in complications or even fatalities. This is where predictive tools like machine learning models can make a big difference by predicting outcomes and by optimizing treatment plans. So how can we apply machine learning to this problem? Well, we can begin by analyzing the historical data, specifically the medical histories of the patients who underwent HSCT. This data would include factors like pre-transplant medical conditions, blood pressure, sugar levels, health conditions, and other relevant health indicators. By examining this data, we can identify patterns in the cases that ended in success versus the cases that resulted in adverse reactions or fatalities. For that, we do a vintage analysis where we can figure out after the transplant by what time majority of the adverse events happened. Based on the historical data that we have researched, say we found that most adverse events happened within the first 3 years post-transplant, with the likelihood of complications significantly decreasing after that period. Now, with this insight, we can construct a predictive model. We will define a target variable or a Y variable based on the patient's status 3 years after the transplant. If the transplant is a success, the target variable will be labeled as 0. If there is a fatality or an adverse event, the target variable will be labeled as 1. Next, we will use the patient's medical history such as their pre-existing conditions as features in the model. By training a machine learning algorithm like random forest or XGBoost, we can teach the model to predict the likelihood of a successful transplant versus an adverse outcome based on these features. The model achieves significant accuracy. Say top 30% of the model can capture more than 60, 70 or even 80% of the fatalities. It can be deployed in production to help doctors to assess the risk before a transplant. The patient would provide their medical history and the machine learning model will generate a prediction showing the likelihood of a success or complications. If the probability of an adverse outcome is above a certain threshold, the healthcare professionals can intervene, perhaps reconsidering the transplant or taking additional precautions. This proactive approach could help reduce fatalities, making transplants much safer and effective for patients. Thus, by leveraging machine learning, we can potentially predict and improve the success rates of medical transplants, ultimately saving lives and optimizing the healthcare practices. This is the power of AI in healthcare. Thanks for watching. If you found this video insightful, don't forget to like, share and subscribe to Scientist Express for more contents on cutting-edge technologies making an impact in various aspects of our lives. Until next time, stay curious and keep innovating.